Hello, my name's Georgia Sims, and I'm a GP working at a practice in a small country town. My special interest is community mental health, and my presentation today is on the subject of what's called social prescribing. I've been involved in a community health project which has been using this, and which seems to be making a difference to the well-being of some of my patients. The project was inspired by the recent initiative that encourages GPs to include social prescribing in a patient's therapy. GPs are now able to write a prescription that allows a patient to attend one of a number of activities, each of which focuses on sociability and the feeling of belonging to a community. The activities encourage patients to link in with non-medical sources of support in both indoor and outdoor contexts. When I first heard about social prescribing, I had some concerns, but I was still keen to explore how it might be of help to my patients who suffer from moderate levels of depression and anxiety. I identified 3 long-term patients who often spoke of loneliness and feelings of isolation, in addition to their mental health issues. But I was a little worried that the effect might be to reduce the input of GPs in patient care and cut back on the amount of direct contact GPs have with them. But after reading about various social prescribing projects that had been underway for a while, I realised this wasn't the case. Indeed, I began to see that my having the ability to prescribe a social activity would be helpful to my patients. Although there are several activities that lend themselves to social prescribing, like walking or singing in a community choir, I decided to go with a gardening project for several reasons. I'd already been contacted by the manager of a well-established community garden, which is tended by volunteers. Unfortunately, some volunteers had recently moved out of the area and more needed to be recruited. The garden is located close to public transport, which was an important consideration as none of my patients are able to drive for medical reasons. My hope was, of course, that the activity would improve their physical health. I'd previously encouraged them to try Keep Fit sessions, but this hadn't been a success. But I also hoped that being out in the fresh air in a non-threatening environment would have a positive emotional effect on them too. I was cautiously optimistic about the benefits to my patients of becoming involved in the gardening project. However, I was concerned that the hard work involved in digging a garden might be a daunting prospect for some of them, particularly those who had physical limitations related to health conditions. For example, one patient had undergone knee surgery the previous year and was understandably cautious about digging. Another patient has chronic back pain and was therefore unable to bend or stoop down. It was important to make sure the project manager was aware of their limitations and could tailor the activities to suit the patient's abilities, and reassure them that the activities were indeed within their capabilities. After the first month of the project, I spoke to each of the 3 participants individually and was pleased by their feedback. All reported that they were enjoying an enhanced sense of well-being. They all admitted that when I first talked to them about the gardening project, they'd not expected to enjoy being out in the fresh air as much as they eventually did. This was the most welcome news for me. All other attempts I'd made to get them involved in such activities had been unsuccessful. One patient added that he left the gardening project each week feeling that it was a job well done. And I was very happy to hear that all 3 felt they had more self-confidence and felt that the future was brighter for them as a result of taking part. It all boded well for initiatives we might go on to set up. Looking back, I realised that I'd been unnecessarily sceptical about prescribing activities that were already available in the community. After all, I'd reasoned, people have been able to join all sorts of community projects on their own for a long time. Why would a GP's prescription make a difference? Something that one patient said, however, brought home to me the value of social prescribing. When I asked him how he felt about being involved in the gardening project, he said, "Without your gentle push, I'd never have considered it." When I asked him to explain, he said that it was like any other prescription I gave him for his condition. He trusted my expertise and viewed my social prescription as another part of his treatment. This, above all, has convinced me that social prescribing